I'm so excited for today's episode. If you work with children with speech sound disorders, you do not want to miss this one. We are going to talk about how long the session should be and how often the session should be. So you can hear behind me, I have the Atlantic Ocean. I'm coming to you from Caparica, Portugal, which is a coastal beach town outside of Lisbon. Let's dive into this really important topic. One of my SIS members, Stephanie, emailed me and she asked, what is the research on how long the speech therapy session should be? What is the research behind the 5 minutes, the 30 minutes, and so forth? And how often we should schedule our speech therapy sessions? This is such an important question. And the answer is not black and white. It is very much, it depends on the child, and it depends on you and what you're doing as well. First of all, take a long, wide angle lens view of this. And that is, if you are a public school speech pathologist, or if you are a private speech therapist, the research indicates you have 30 to 45 minutes a week to provide speech therapy. End of story, regardless of the severity of the speech impairment. So what that means is a lot of insurance companies are only going to cover 45 minutes a week for speech therapy time. That means as far as the school caseloads are concerned, which are huge, you're only going to be able to dedicate probably maximum 45 minutes a week of speech therapy time. This is our budget. I'm not going to share with you the research in which they spent 2 hours a day, 5 days a week for therapy. That's just not feasible in the private setting or in a public school setting. Maybe over the summer, you can do a program like that. And the research does support that sort of program, especially for children with childhood apraxia of speech or severe motor speech disorders, in which you give them both the frequency, the daily intervention, and you also give them the duration. So they get duration and frequency. However, I don't know who can pay for that or how they can pay for that, but that might be something you want to try for a summer program. What we're going to talk about today is, what are you going to do during the school year, or what are you going to do year round if you're working in private practice? So I'm going to stick to that budget. And that's because Parkinson's law states that when you're given a budget, you're going to work more intelligently with it. For instance, if I said, I'm going to give you $10, go buy breakfast for the group, you're probably going to go and get oatmeal. Maybe you'll get some almond milk. You're going to be very intelligent with the resources I give you. If I say, here's $50, go buy breakfast for the group, you're going to buy things that perhaps you don't need. There's going to be a lot of fluff. Maybe you're going to get some mimosas or something that we're really not going to need because you have the money to do so. So what I want to do is I want to stick with that idea that you only have 30 to 45 minutes a week when I review this research. So even though there are multiple studies out there in which they've provided 2 hours of therapy a week, in which they've provided 5 hours of therapy a week, I'm not going to go there. I'm not going to cover that because of the lack of ecological validity, because that is just not valid in the real world. What I'm going to do instead is I'm going to dive into the research and reviewing the research. What do we have that supports the 5-minute model? What do we have to support a 15-minute model? What do we have to support a 20-minute model? What do we have in the research to support 30-minute model? And what do we have in the research to support hour-long sessions? We're also going to talk about frequency and how many. So let's start with the 5 minutes and we're going to go from there. Now, a lot of times I hear people say, well, I do this evidence-based practice and I'm working with preschoolers and we're doing 5 minutes every day, 5 days a week. And I really don't know where that research is coming from, because there really isn't any published peer-reviewed research to support 5 minutes of speech therapy for preschoolers. It simply is just not out there. If it is out there, please correct me and I will be the first to air that. However, many people do follow that model, believing that there's research to support it. There simply isn't. There is a clinical expertise article that was written in 2007 by Brogan Johnson in Poland. And that article advocated at the elementary age, between kindergarten through 5th grade, they treated speech sound disorders individually using telepractice with 6-minute sessions 5 times weekly. Now, there was no comparison group. This is not experimental research. They just tried this model in which they were working with different schools, so they didn't have to travel, and providing quick 6-minute daily sessions. They reported, these speech pathologists did, that it was effective, that it worked, and that they said the children were meeting their goals, and that the other staff liked it, and that it had ecological validity. So it's not really evidence-based. It's just someone saying, hey, I've done this model and it really worked well for me. Just take it with a grain of salt, because a lot of people say that their approaches are evidence-based, and people say I'm doing this evidence-based approach, and there really isn't the evidence behind it. When you do the Wizard of Oz and you move the curtain, there's no research behind what they're purporting to be evidence-based. Let's go into the next 5 minutes of research. So Byers and colleagues in 2021, once again, this is not preschool age. I have not seen any 5-minute speech sound disorder preschool age research out there. This is school age. This is very important because school age children, they are able to come in, you got the deck of cards, you go through it, and then they leave. They know the routine, okay? They're older, they have those executive function skills where you sit down, you do your thing, and then you go on your way. You're in and out. You say the word 10 times, and then you get a stamp, and then you go on your way. Byers and colleagues found is they did the 5-minute model, and they did it individually with children, okay? And they did it 3 times a week. And then they compared that with children that were receiving 2 30-minute sessions in groups of 4 children. They did these 2 30 minutes a session. They call this business as usual with groups of 4 children. So within those 30-minute sessions, they had different targets for each of the children, and each of the children had to wait as the other 3 children did their practice target. So they didn't really get that dosage. I know when I work with peers, I have the children speak in choral to make sure that we're getting that high frequency production, because production really, really matters. But they didn't do it that way. They did your turn, your turn, your turn, your turn, and we all have different targets. When they did that approach, what they found is that the children that had mild or mild to moderate, they're not even moderate, those are the children at elementary age that benefited from the 5 minutes individual, just you, 3 times a week, instead of being groups of 4 and receiving twice weekly 30-minute sessions. So the way it pans out is because they were taking turns with each of the children. Each children had different targets. You kind of got, each child kind of got like a 5-minute, 6-minute segment, because each child was like, now it's your turn to do it. Okay, now you go work on your craft. Okay, we're going to come back to you. Now it's your turn. Now you go work on your craft, and we're going to come back to you. What they found is that was benefit for the children with mild or mild to moderate speech sound disorders. They benefited from 5 minutes, 3 times a week, more than the twice weekly 30-minute sessions. Now the children with the moderate to severe impairment, they benefited more from the group sessions that were twice weekly, 30 minutes. Now, why that might be the case is that when you're dealing with children with moderate to severe speech sound disorder impairment at elementary age, these are children that are more likely to have executive function difficulties. So if the child has executive function difficulties, operating in this quick come in, transition out, 5 minutes, that could be challenging. This really does make sense on why a lot of transitions for a child with executive function difficulties, coming in, quickly completing the job, going out, might be difficult. That is probably a contributing factor and something to keep in mind when you're scheduling. In this instance, once again, no preschoolers with this quick 5-minute approach that worked with elementary age children that had mild or mild to moderate, not even moderate speech sound disorders. This quick individual in and out approach, it was good, better for that population. The other population benefited more from being in groups of 4 children and getting 30 minutes twice a week. Even though they didn't get that higher dosage necessarily because they're taking turns with 3 other kiddos that have different speech targets, I think it's because it wasn't that quick transition that is difficult for children with executive function difficulties. Let's move into 15-minute sessions. So Kruger and Storkel in 2023 did some interesting research on this. Is only 8 children. So 8 children means this only applies to 8 children. It doesn't apply to the children on your back porch by any means. There's no statistical generalizability, but it does give us some ideas of different phenomena. They used the liquids L and R with preschool age children, and they used complex targets with elementary age children as well. They found that the preschool age children just as well, they learned the LNR. Don't wait for later to give them complex targets. They were effective for the preschool age children. Give them the good stuff, give them the complex targets, you're going to get better gains. The preschool age children benefited more from 20-minute sessions, and I believe it was twice a week. I couldn't tell from the article, than 15 minutes. The reason they report that is because when you're working with the preschool age children, there's more feedback involved. There's more redirection involved. There's more questions involved. When they were working with the school age children, they knew the routine. They came in, they could do the high number of productions, the 80 productions of the complex target. They're like, I got this. I've been doing this for years. The preschoolers are like, we play. What are you talking about? We're going to say a treatment target. There's a lot of other feedback going on. So in order to make sure that these children were producing the target at a high number of reps, they needed more time. What they found, Kruger and Storkel, with preschool age children, is that the preschool age children benefited more from having a 20-minute session instead of a 15-minute session, because in 20 minutes, they could do 80 accurate productions of the utterance. Now, when they were in 15 minutes, they couldn't hit that number of 80. The latest research, however, is also indicating that complexity matters. And when you're doing complex speech targets, you don't have to do as many. It's the same thing as working out, for instance. If I give you a 50-pound dumbbell, you do not need to do 100 reps with a 50-pound dumbbell. If I were to give you a 5-pound dumbbell, you would need to do 100 reps. You have to consider the complexity of the target. If you're like me and you're working on the word scrape, the child does not need to produce scrape 80 times. If you're working on a singleton blend, such as the P sound or S sound, you are going to need to produce that sound more often, because challenge does create change, and it does matter the complexity of the target. Another study that I wanted to share with you in the 15-minute sessions was Reffeld and Sulak. And Reffeld and Sulak went into elementary age, and they randomly assigned children either to 2 30-minute sessions or 4 15-minute sessions weekly in a public school setting. And what they found is there was really no difference when it came to their goal achievement. Now, the problem with the study that I don't learn goal achievement. And if you're like me, I work with children who come from many different sources. Some of the goals are written really easily, and some of the goals are written very challenging. So it's hard to compare grapes to grapefruit. Some of these speech therapists have given me a child and they're writing the complexity approach goals. They're writing goals for clusters. And some of them are writing goals for the child, the CVC words achieve their goals. But the child with the cluster goals is gliding R. However, they're going to have, this child did not achieve the goals and this child did. However, I'm comparing grapes to grapefruit. So the problem with that study, even though the study is ecologically valid, because yes, you can do that. You can see children twice a week, perhaps for 30 minutes, or you can see children 4 times a week for 15 minutes in a public school setting. You're pushing the envelope a little bit. However, you are comparing grapes to grapefruits, because the way goals are written, there's a lot of variability. So you can't really say it's better to do 4 15-minute sessions or it's better to do 2 30-minute sessions. The variables are just not controlled for, unfortunately, by using different measurements. Let's go on to the 30-minute sessions. Now, this was a wonderful study that was done in 2013 by Melissa Ellen. She had preschool age. These are our children, 3 to 5 years old, that is my area of expertise. What she found is if I do once a week for 30 minutes in treating speech sound disorders, she was using the multiple oppositions approach, and I do it for 24 weeks, would that be better, or would it be better if I did it 3 times a week for 8 weeks? She found is 3 times a week for 8 weeks had better outcomes, statistically significant. The problem with that is obvious. We're over budget. You're talking an hour and a half. I see no children on my caseload for an hour and a half a week. So I have close to 50 students on my caseload. I've told you this many times before. And the children I work with have complex communication needs largely. I work with the children with the most severe communication impairments. I still don't have an hour and a half. Because of that, I find that research kind of not useful to many of us. It's unfortunate that the research was not comparing once weekly to twice weekly. It would be much better if we could say, hey, did we get the same gains in 12 weeks doing twice weekly as we did once weekly in 24 weeks? That we could use. We could say we could maybe give the children an hour a week of speech therapy. We could find a way to make that happen. It's unfortunate that it doesn't have the ecological validity. An hour and a half is simply more than most private or public speech pathologists is providing. However, what that research does tell us is that frequency matters. It's not how much therapy you're receiving, how often is important. So we're going to keep that in mind. How often is important. Thank you for that important study. It was, I think, the best out of all of these studies that was completed because it was a random control trial. And it also had another group that was a storybook intervention group. And that was to control for attention effects. What if these children in maturation received the same amount of attention, but it was in a storybook literacy intervention group? Let's go on to the next area, which is 50-minute, 1 hour a week speech therapy sessions. Now, in this speech therapy session, this is very interesting. Recent research came out between Patricia McCabe and Jonathan Preston, and I'll talk more about this article later because it was a great article in 2023. And this article showed that children benefited from childhood apraxia of speech, where with childhood apraxia of speech, we know that frequency matters. The research they did was 2-hour-long sessions, and they showed with 2-hour-long sessions, within a 3-month period, we can make considerable gains in childhood apraxia of speech using the rest or biofeedback. Now, this was really interesting because they were doing biofeedback with children as young as 6 years of age. So this is something totally new. I'm used to biofeedback being done with children that are over the age of 10. In this study for childhood apraxia of speech, the average age was age 8 for biofeedback, and it was young as age 6 years old. I found that fascinating myself. But anyhow, they did make considerable gains. However, once again, they're providing 2 hours of therapy a week. Now, that is not going to be covered by insurance companies. That is not going to be covered by a public school caseload. Unfortunately, it lacks the ecological validity. What we do know when we look at this is we know that children with childhood apraxia of speech benefit from frequency and also the duration of the sessions. Now, later, I think this is McCabe's student, Thomas, she looked at the REST approach and said, well, what about if we do it just once a week for 50 minutes? She looked at 5 children, and only one of the 5, after that 50-minute session, this after 12 sessions, generalized, in which the gains that they made in therapy went to untreated words. This isn't enough. Once weekly doing the REST approach is not enough. And the fact that only one of the 5 was able to make gains in untreated words. The research suggests is after 2 months of speech sound disorder therapy, you should see generalizable gains. It should show up on the speech sound disorder test generally. There are exceptions, as I've mentioned before. Children who have ADHD tend to not test well and tend to not self-monitor well. There are exceptions to that. However, that is generally, as a general rule, what's expected. When we're looking at all of this data, I want to leave you with a ball in your court. So, and this is why the ball is going to be in your court. If you're like me and you're using complex speech targets, you're not going to need the same dosage. If you are having the child, like I do, say a complex paragraph that's loaded with 3-element blends, you are not going to need to do that 80 times. That is a 50-pound dumbbell. What I'm going to say is you're not going to need to have a 60-minute session. This is just one area where it depends on not only the child, but what are you doing? So it's also, what is the therapist doing? If the therapist is doing drill and kill, the dosage is going to become very important, because what you're doing is you're doing calf raises. You're working one small muscle. Okay, if you're doing that in order to create functional communication change, you are going to have to do it a lot. You're going to need high repetitions. Challenge does create change. And if you're using a less challenging treatment target, you need to increase the reps, right? So that is one factor to consider, because all of this research, it is what it is, and your practice is what it is. And how you're going to apply this to your practice has very much to do with the child and the child's characteristics, as well as you and what you're doing in therapy. That said, there's three trends that have emerged from this research review. The first is that frequent short sessions, they might be insufficient if they're too short in length for preschoolers. They don't know the routine. They don't know you go in and you say the word a million times and then you're in and out. Secondly, from the research, we know that 5 minutes may just not be enough intensity for a child that has moderate to severe speech sound disorders. That just might not be enough to make a difference. They might need more dosage. You almost think of it as they need more of the medication. It's too small of a dose. Okay, so that means they need to do more reps, or they need more complexity for change to occur. There's research really on the efficacy of one 30-minute or one 45-minute speech therapy session is very much dependent on what you're doing. Because right now I'm reviewing research on children that have seen once weekly for one 30-minute session a week that were below the 1 percentile. And these are children who were only seen for speech sound disorders once weekly, 30-minute session below the 1 percentile, who made immense gains within a school year. What I'm saying once again is that, does the duration of the sessions matter? Yes. Does the frequency of the sessions matter? Yes. But what you do really, really matters with that time, and what kind of home practice you provide to ensure that there's consistent daily practice going on. What I encourage you to do, if you want to service your children in the best way possible, research your practice. And it's very simple. I think when people hear research, like, what are you talking about? I need to be in the ivory towers. You don't. But you need to take your blinders off when it comes to your own children and when it comes to what you're doing and how they're responding to it. So what I encourage you to do is open a Google Doc, okay? So you open a Google Doc for the school year. And that Google Doc, if it's like mine, it's protected within the school district. It has some nice safeguards on it. And what it would do is put the child's initial there. Then every progress report, use the same articulation test. Now, I like the CAP2. It's easy to give, and I do much of my speech sound disorder treatment on children with autism who are not the easiest to test. I give the CAP2 every progress report, period. And the CAP2 tells me, are these children making generalizable gains or are they not? It takes me 15 minutes to give that test. It takes half a speech therapy session. It's information every progress report period, 4 times a year, that I take to see, are my students making gains, or are my students not making gains? Now, when you do that, you have the student's initial. Next to the student's initial, you have, how often are you seeing this child for therapy? Twice weekly, 30-minute sessions, once weekly, 30-minute session. We have it right there. Then after that, you have quarter 1, quarter 2, quarter 3, quarter 4 gains for the school year. Now, what you need to look at is, are these children making considerable gains in speech sound disorders, or are they not? And if they are making considerable gains in speech sound disorders, there's no need to DSD. There's no need to do something different. However, if they are not making considerable gains, you're going to want to try the DSD. You're going to say, who is making considerable gains? Okay, the children who I'm seeing twice a week for 20 minutes, they're making greater gains than the children that I'm seeing once a week for 40 minutes. So I'm going to want a DSD. So your numbers are going to give you this objective feedback that's going to help you make better decisions. But that is going to be better than the research I share with you today. Because these researchers are not doing what you're doing. These researchers are not treating children that you treat from your back porch. These are unique characteristics that are going to have a major impact on your outcomes and how often and how long your session should be. The only way you're going to know this is by opening a Google Doc in your protected documents, go ahead, put the children's initials there in your Google Doc. Put the quarter 1 gains, put the quarter 2 gains, put the quarter 3 gains, put the quarter 4 gains. Look at the end of the year and say, how many less errors do these children have at the end of the year? And you're going to say, wow, this isn't working. I need a DSD. Wow, this is working. I need to do more of this. That is how you're going to know at the end of the day. As you can see, if you're here with me on YouTube, the sun went down on us, so it is time to go and party. It's nighttime here. I'll see you next week. If possible, I'm going to be in Obidos, Portugal, in a castle town. If they have Wi-Fi there, I will be there. In the meantime, I want you to roll up your sleeves, make the world a better place, one child at a time. You will always be first.